Okay. Again, thank you to everybody for coming and listening to us speak today. My name's Grayson Whitaker. Some of you have known me previously as Grayson Hall. Recently got civil partnered, so I've changed my name. So I am the person you think I am. I'm presenting for the BU project run by Porchlight. And the reason that I'm doing this is because, yes, LGBT plus young people and adults are disproportionately affected by homelessness, but we also struggle a lot with self-harm and suicide ideation and action. And it's something that we see a lot of in the BU project. Our safeguardings are quite often centered around this topic. So I just wanted to provide some information about the BU project and how you can support LGBT plus young people better as practitioners. Next slide, please, Laura. So the BU project runs across Kent and Medway. We run face-to-face and online groups for 13 to 17-year-olds who are LGBT plus. We run support groups online for 18 to 25-year-olds. That's only online at the moment, as it's worked better for our 18 to 25-year-olds to run online than it was face-to-face. Means that they can meet lots of different people from different parts of the county, or the two localities, Kent and Medway. We also have a parents and carers support group, which means that parents and carers of LGBT plus young people have the support that they need to be able to support their children, because supported parents means supported children and young people. We also provide one-to-one support, which for the face-to-face groups, the online groups, and the one-to-one support, we have a referral form, and we also have other paperwork that we go through with our clients. So if you wanted to receive that paperwork for referral purposes into face-to-face groups at the moment, that would be really good. I can have that sent out to you at some. I think if they send out the slides, we can send out the referral as well. We also have specialist groups for intersectional young people, so a faith group and a young person of colour group. The reason we have this is because the intersecting experiences of multiple marginalised communities means that people are really going to struggle in multiple ways, not just being LGBT plus. We run activities throughout the summer. One of those was our Reconnect big day out that we ran very recently, which was really fantastic. Our young people turned up, had a really good time in the sun, on lots of activities, crafts and physical activities as well. And we also are running more regular activities for our young people, so that they get to see each other in real life, meet up, not just do an online or face-to-face structured group, but something a bit more fun and exciting for them to do together. Next slide, please, Laura. So supporting the LGBT plus community, these are the kind of things that you need to do when you are supporting this community. The support that you offer needs to be explicitly towards the LGBT plus community. It's not enough to just blanket with protected characteristics or say everyone is welcome. The problem with that is that if we're not explicitly involved or included in the language that is used, we feel excluded because there's not the right provision there for us. So for the LGBT plus community and other marginalised communities, the support offer needs to be very explicit. We also, within the BU project, our workers, the people that provide that support, are LGBT plus. They have that lived experience and the knowledge. We also go on a lot of training sessions, trauma-informed care, LGBT plus training, lots of other opportunities that we take to make sure that what we're providing is the best that we can possibly give, not just through our own lived experience and understanding, but through going through other avenues, CPD trainings. We recently did one with Mermaids UK, which was fantastic. Understanding the language that young people are using, it's going to change. It always does change, but it's really important that we try to understand that growing development of language and not just say, oh, I don't know what that means. Ask. You're allowed to ask what that means to a person and to understand what someone's identity means to them. Listening to young people that we support is really integral. We get sometimes referrals in from people and they haven't really listened to what the young person wants, because when we talk to the young person, they say, well, I don't want that, I want this. So even from that referral pathway, we need to really be listening to the need of that young person, the family as well in some cases, but really that young person's voice needs to be at the heart of what we do, not just for the BU project, but for other practitioners, other partners as well. We need to work in a multi-agency capacity. This is something that we do talk about a lot in this sector, working together to put those pieces of the puzzle together and work jointly so that everyone's aware to the right and proportionate extent of what's going on for this young person. So it's always something we're trying to embed, not just in our work, but the people we work with as well. And not expecting young people to be the experts in their medical care or other types of care as well, because our cohort, the LGBT plus cohort, tends to feel pressured to know everything about their pathway that they're going to go down, whether that's medical or social. And actually, it shouldn't be down to them to understand the be all and end all of everything they're going to go through. Because one thing, they might change their minds as they go through a process. That's perfectly normal and acceptable. But also, the practitioners should be the ones understanding what's going on and giving them information, not the other way around. So that's what we're trying to embed in the work that we do, and also deliver training to other practitioners so they understand these kind of barriers, these kind of things that they need to know when supporting LGBT plus young people. Next slide, please, Laura. So recently I conducted, with the help of our involvement team in Portside, I conducted a survey. It was a small survey. We had 37 respondents across Kent and Medway, and we're all currently organising interviews to follow up from that survey. The questions that we asked were around identities, coming out, and hate crime experiences, as well as experiences of other services. I've got a couple of graphs on the next couple of slides I can show you that kind of demonstrate coming out, because there's some really positive stuff coming out of this, that we can understand what's going on for our LGBT plus cohort and when it comes to coming out. So next slide, please, Laura. So it's a little bit blurry at my end, but I can still read it. Hopefully you can as well. So when coming out to family, the words that jump, basically I had a matrix question. It wasn't just young people, no, it was adults as well, because we run between 8 and 25, so it's young people and young adults, as well as some further age ranges as well in this particular survey. Katie, thank you for that question. So when coming out to family, the words that were the most prevalent for family in comparison to friends and colleagues and peers was afraid, hopeless, and isolated. So when people had the chance to ask this particular question, they selected how frequently they were afraid, hopeless, or isolated when coming out to family and friends, colleagues and peers. And they kind of figured out what was going on for them at that time when coming out. So in this particular scenario, coming out to family, there were some negative connotations because of the pressure of, what if my family don't accept me? What if they don't love me? What if I'm kicked out? Those kind of things. But if we move on to the next slide, please, Laura, we can see that when coming out to friends, we had loved, belonging, and supported, and these were the most predominant in coming out to friends. That the sense of belonging, the sense of being loved and supported was really there for the friends part. So we can kind of understand from this small survey how people respond when coming out to. So basically, what I'm trying to say is, if someone comes out to you, or you think someone might come out to you as a practitioner, a friend, or a family member, really go in with an open mind, because this person is probably really afraid of talking to anyone. If you're the first person they come out to, that's a massive privilege. So next slide, please, Laura. So what can you do? Support those who are afraid to be themselves, as I've just said. There'll be we shouldn't be pressuring people to come out, but at the same time, if they want to, we need to facilitate that space. So maybe they can come out to their close friends, maybe a close family member they trust, or a teacher, or a trusted adult. And we need to figure out a way so that these young people and adults who are not out and want to be and are safe to, can come out in a way that's really positive for them. And finally, I just want to say that asking questions of the LGBT plus community is okay if you do it in the right way. So asking, how do you identify, is fine. You can do that. You can also ask, what pronouns do you use? And I would really, really recommend asking, what pronouns do you use? Because what that does is it really encourages people to normalize pronoun use in regular conversation. And what does that mean to you? Because identities are all different for different people. We may have a stock understanding of what the word lesbian, gay, bisexual, and transgender mean, and all the other terminology we've got in the LGBT plus community. We may understand that on our level, but actually it's not exactly the same for everyone. So do ask, what does that mean to you? Can you explain to me what your identity means to you? And that way you're being really supportive of that young person or adult that's come to you for support. I believe that's the end of my slides. So thank you so much for listening to me, and I will let the next person have their time in the spotlight. Thank you.
Thank you so much, Grayson, for an incredibly nuanced and very well thought through presentation. I'm just checking, we haven't got any questions specifically for you at the moment, but they may come in, and once we've had all of our speakers, it may be that we have more of an opportunity for further questions as well. So I'm going to move on to Fiona from Emerge. And Fiona, I'll let you introduce yourself properly. And whilst you're doing that, I'm just going to get the video up and sharing, and then you can let me know when you want me to hit play.
Thank you, Laura. Hello, everybody. I am Fiona Gilpin. I'm the project lead for Emerge at Medway Hospital. We launched in 2020 last year. We were due to launch in hospital, but unfortunately, COVID put paid to that. So we quickly scrambled, and we have been able to offer a remote service to our young people in that time. So the age group that we are working with is 10 to 25-year-olds who are self-harming, who are struggling with suicidal ideation, suicide attempt, and or emotional crisis. As of the 4th of May, Star Wars Day, May the 4th, we have been able to be at Medway Hospital in person. And so that is where we are finding our young people. So we are going in, and the video will explain the whole process of what goes in the hospital. This has been operating in Surrey for the last 5 years. The first project has been at Medway Hospital in Kent. I'm now actually moving over to do project lead work in Maidstone and Tunbridge Wells hospitals, and there is also a project that is starting up at Darrants Valley. So Darrants Valley and Medway and Tunbridge Wells will be up and running by the end of the year, and Medway will continue on. And this 7.5-minute video will trace exactly who we are, what we do, and how the process works. So thank you, Laura. Off we go. I haven't got any sound, Laura. I don't know if anybody else is struggling with sound.
Technology is clearly still not with me. Give me one moment and let me try again.
There's still no sound for me. I don't know about other people. Jodie's put you have to select share audio option 2.
No sound that time?
I didn't get any.
You couldn't hear it. Okay.
No.
it should be there because I had clicked for the sound to be there. Okay, let me try once more. Let me give this a quick go. I'm going to leave my microphone on in case there is an issue. I can see some people saying there was sound the second time round for them. Okay.
Hi, my name's Joy and I'm the founder and CEO of Advocacy, and I'm just going to tell you really quickly about it now and how our service can really help and support young people who are under your care within the ED and various other areas in the hospital. So, Emerge Advocacy, if you want to know more about our charity, you can go to emergeadvocacy.com. And our teams are there to be a voice of hope for young people aged 10 to 25 who are in A&E and on any of the other wards in the hospital, where people coming in because of self-harm, emotional crisis or suicide attempts might be found. We have a team of staff and volunteers who are there to be a non-clinical presence. So we don't take the place of anything else that goes on within the hospital, but we're there to come alongside and really just try and help the young people through the process. We're there from 7 p.m. till 11 p.m, so during the evenings. And we also provide follow-up support for young people when they come out of hospital too. So if we've met them in hospital, then straight away when they come out, we can meet them for a walk, for coffee, hot chocolate, chat, and just really try and help see what's going on with them, try and help them to engage with services in the community, and ultimately try and help to stop them from bouncing back into the ED again. We're there to listen, to give our time, and that's something that we do have that we can give, and we can spend plenty of time with that young person. We're there to encourage them to engage with the care and treatment that you are trying to provide for them, and that mental health and social services are there to give as well. And we're there to just really reassure them and offer some distraction, comfort and reassurance. And ultimately, as I said, to be a voice of hope for them, that things might feel really difficult right now, but they can get better. So where do we work? Well, in Medway, we started the project there in 2020. You can see the phone number there for Emerge at Medway Hospital, and I'll tell you more about how to refer in just a minute. We're also at Down Valley Hospital, and you can see the phone number there, or we will be soon in 2021. And also at Mason and Tunbridge Wells, that project starting in 2021. So this is what our flyer, our leaflet looks like. This is Medway's one, as you can see, but it just really simply explains to young people or their parents who we are, what we're there for, and it's got some lovely mugshots of our team so that young people can see that we are real people, and that's just a little sample of who they might be seeing. So how does the referral process work, I hear you ask? Well, what happens is that a nurse or doctor can explain to the young person that you have this awesome service called Emerge, who can come and support them, and that you've got a youth support worker who's ready to come and visit them if they would like. So if they say, oh yes, that sounds like a good idea, then you can make the referral to us. And if it's early on in the day, that's fine. We'll come and see that young person in the evening when we arrive. But we'll also, during the evening, we'll walk around the hospital, come and chat with the staff. And so then if that jogs your memory, you go, oh, I do have somebody over there actually, then you can just go and ask them. And then if they want, then we'll support them straight away. So if the young person agrees and you make the referral to Emerge, you fill in a really teeny tiny form, which I will tell you about in a minute. And then once that's done, then you can introduce our team member to the young person. Simple. So just a couple of things on that. You have to get their consent in order to make the referral. Don't tell us any information about the young person unless you've got their consent. You can refer by phone, as I've said, or in person if we've wandered around and said hello in the evening. And our support does not take the place of anything else that is going on for that young person. We're just there to come alongside and support them. We can support the young person at any point during their admission, from when they first show up in the waiting room right up until the point of discharge, and we do have people referred at point of discharge. Obviously, it's better if we hear about them sooner, because then we can come and support them whilst they're still with you. But if we do get them at discharge, then we can still do follow-up work with them, and that sometimes happens if maybe the psych liaison are the last people to see them, and it's them that make the referrals. So the referral form, I told you it was really simple, it's quick and easy. This is all you need to do. So you just fill in the patient's details and your details, and you affirm that they have consented to the referral. And in doing this, you're basically just affirming that you believe that this is appropriate and suitable referral to be making. And then there's more information on the back that we fill in. And then when that's done, that just goes into the patient notes, so that any other professional who's working with that young person knows that Emerge has seen them. We obviously make other notes, but those don't go into the patient record. And of course, we always pass on and escalate anything that's to do with risk or safeguarding. So when we support a young person, we ask for their feedback. We say to them, we send them a text so that they can do it anonymously, and we ask them, how many stars out of 5 would you give the support that you received from Emerge? And I'm really pleased to tell you that our average feedback score is 4.7 out of 5, which is just amazing. And young people really value the informal support that we can give. One young lady said this: the lady I spoke to didn't ask any questions about why I was there, and just talked about things that I like in order to take my mind off the situation. She was very nice and easy to talk to, and made me feel better by the end of the conversation. And I think that that really kind of sums up what it is that we're there to do. So if you would like to refer a young person to our service, just as I said, give us a ring or speak to the team as they come around. We are available on designated evenings. It's not 7 days a week. We are a voluntary service, and we start building up them from 3 nights a week up to 6 as our team grows. So just check our website if you want to know which evenings we're available in your hospital. Currently, I'm not giving those details here because they will increase, and then this will be out of date. So go to emergeadvocacy.com if you want to know more, and click on our projects page. We're available from 7 p.m. till 11 p.m. And please, if you call us and we don't manage to pick up the phone, do leave us a voicemail and tell us who you are, where you're calling from, and we'll get back to you just as soon as we can. So that's us, Emerge Advocacy. We're here to support young people that are within your ED, aged 10 to 25, with self-harm, suicidal ideation, or emotional crisis. Do get in touch, and we look forward to supporting your patients really soon. Thank you.
So that's the easiest, quickest summary that I have in terms of presenting who we are and what we do. I have been answering some of your questions in the chat box, but if there's any other questions or queries, I'm more than happy to respond to those. And you're in Ashford, so it'd be great. Yes. We'll have to wait and see what goes on with the William Harvey Hospital. As yet, we're not in East Kent, unfortunately. Our referral follows the hospital footprint. So that's Medway and Swale. And obviously for Darrant Valley, that's going to be Dartford and Gravesham. And for Maidstone and Tunbridge Wells, that's going to be around that area as well. So unfortunately, not in East Kent as yet, but watch this space, hopefully.
Okay, I can't see any other questions at the moment, but again, do think if there are other questions you would like to put to our speakers. We're going to have a little bit of time after our final presentation for a bit more discussion. So again, do use the chat to put some comments or questions in there. Without further ado, firstly, would like to say thank you very much to Fiona for coming along today and for sharing details of that service. It's just so fantastic to be able to share details of any additional services that are available to support our young people across Kent and Medway. So thank you so much for coming and sharing that with us today.
Thank you for asking.
And without any further ado, and hopefully without any further technical issues at my end, I am going to load up the slides for Sophie from Mind and Body. And Sophie, I will let you introduce yourself whilst I get your slides up on the screen.
Thanks, Laura. Hopefully everybody can hear me, but if there's any troubles, hopefully it'll start appearing in the chat if people can't. So thanks ever so much for having me along today, and thanks to those of you who have chosen to come into this breakout room. I am going to be talking a little bit about Mind and Body. So some of you may have heard of us already, but I'll be talking about what it is that we do at Mind and Body and how you can refer into our service. So thanks, Laura, for getting the slides up. If you're happy to go to the next one, that would be fab. Thanks. So just to quickly say here around what I'm going to speak about, I've already mentioned that I'll be speaking about Mind and Body, what it is our programme covers, who we can support, and then how to access into our service. And as mentioned at the end, there will be questions. I'll try and keep an eye on the chat, but if not, I will catch up at the end and answer any that come in. Thanks, Laura. The next slide would be great. Excellent. So to give you a bit of a national picture, we come under the charity We Are With You. So as a charity, we offer free confidential support. There's a lot of services and projects across England and Scotland. We offer support around drugs, alcohol and mental health support. And as well as face-to-face, we offer a lot of help and advice online, and we have a chat service as well available to people. Next slide, please, Laura. Thank you. And you could go, when these red ones come up, you can sort of skip straight to the next one. Thank you. So we are commissioned in Kent, Cornwall and Lancashire, and today I'm going to be talking to you about our Kent project. So we support 13 to 25-year-olds who are deemed vulnerable to self-harming. So it may be that they're having thoughts or actions of self-harm, or it could be that actually they're just struggling with their well-being and struggling to manage some of the big emotions like stress, anxiety, feeling really low. So we're an early intervention programme, and by that, one of the criteria for those coming onto the programme is that they haven't had any steps towards ending their life within the past 3 months, and that they don't have any current suicide intent or plans. And the reason for that is that if young people were experiencing that, then we would consider them to be better supported at this time by a specialist service at a higher tier. So Mind and Body consists of one-to-ones and small group work sessions. So we have a one-to-one with people at the beginning, middle and end of the programme. The programme usually spans across around 4 to 6 months. And in between those one-to-ones, we have our group work sessions. And this is where the real core work takes place around looking at people's triggers for certain emotions, how to manage some of those emotions. So we look at alternative coping strategies, distractions, diversions, and how to communicate with others as well. We predominantly run in schools. So our school pathway is that we would deliver an assembly to a whole year group, and we work with year 9s through to year 12s. And in that assembly, we introduce the programme, and following the assembly, the whole year group is invited to complete an online survey, which has been developed with researchers and is designed to highlight those that would potentially benefit from the support. And we usually have about 25% of the year group highlighted. So often it's around 50 young people, depending on the size of the year group. All 50 of those, unless school are saying they're already accessing specialist support, which we obviously wouldn't want to interfere with, those young people are then invited for a pre-one-to-one, which is then when we explore if Mind and Body can support them, and we'd complete our recognised outcome tools with them to help us determine what are the goals for that young person. We have a really person-centered approach, so it's all around what they would want to gain, what improvements do they want to make, and then can we support them to get to where they want to be. And then we also have a community pathway. So for anyone wanting to access the project, if we're not currently in their school, then they can access one of our community groups. And we tend to meet in local youth hubs. Sometimes local cafes have private rooms that they hire out to charities and places like that. So we're meeting somewhere really accessible within the community. And then we also offer support to parents and carers and training for professionals as well. Next slide, please, Laura. So here's, I won't read all of these out, but there's just a bit of background. We've been running since 2016, supporting 13 to 17-year-olds across Kent. And then more recently, we now have a pathway for 18 to 25-year-olds, again, across Kent. And we've also expanded into Medway now as well for the 18 to 25-year age group. And this slide is just detailing how many people we've supported. It's detailed from January 2017 because that's when we went onto our online system, our online database. Prior to that, we were paper-based, so it's a little bit trickier to include some of those stats. Next slide, please. So this I've already briefly spoke about in terms of we have our, in red, our assessments throughout, and then our 8 group work sessions, and it's just detailing which is the main topic for all of those. We have a really structured programme and session plans that are followed because it's all evidence and research based. Next slide, please, Laura. Here's some of our outcomes from our latest report. So you'll see that those completing the programme, we've helped them to reduce their self-harming thoughts and actions, increase their well-being, and we also find that people report being able to better manage risk in relation to self-harm and a reduction in suicidal thoughts. And the box at the bottom is just detailing the validated outcome measures that we use. Next slide, please, Laura. So here's our eligibility criteria, which I've slightly touched upon already. So they have to be between age of 13 to 25, living in Kent, or it could be that somebody's registered with a GP or attends school in Kent. So as long as they're ticking one of those, then that's absolutely fine. And the same applies for 18 to 25-year-olds in Medway. Somebody has to be willing to take part in group work. That's a huge part of it. And often we do find young people are initially anxious around entering that group session, but we say to people, if they're willing to just give the first one a go, they can step out at any point, it's voluntary. If they're happy to trial it, if we can get them to that point, then we're finding that people tend to then stay to the end of the programme once that initial fear is overcome. And actually, we have a lot of feedback at the end saying that the group work was an element that was really impacting speaking to other people, reducing isolation, and feeling like they're not alone. So that's why we see that as really vital. As mentioned, somebody has to be appropriate for early intervention, because otherwise it may be that actually they're better sitting with an alternative service like CAMS. And yeah, I think those final points again, I've touched upon, and consent is vital. We're a voluntary service, so as in the previous presentations, please only refer if the young person is aware and consenting to the referral. Next slide, please. So a little bit about the support we can offer to parents and carers. So there's 2 options here. One is that we're able to offer up to 3 one-to-one sessions with parents. And this is available to those who have young people who meet the criteria of the programme, because the work that we cover with them is again aimed at early intervention. So they don't have to have a child on the programme, but it has to be that what their young person is experiencing would fit the criteria for early intervention. An alternative option on the next slide is that we have open access online information sessions. So these are 90-minute sessions where we cover the topics listed here. Again, I won't just read out what you can all see on the screen, but these sessions are open to absolutely everybody. So it may be that it's just parents curious for further information, even if their young person isn't going through anything that they're aware of, or it could be open to parents and carers for young people who have children accessing alternative services at the moment and specialist support. So there's a link to it in the presentation that will go out afterwards, and please do feel free to share that link with anyone who you feel it may be useful to. Next slide, please. So accessing our service. Anybody can refer into our service. So again, there's links here in the QR code on the screen, which is also included in all of our posters and leaflets around the county. That takes you directly to our website, when you can download Word versions of the referral forms and send those into our office. Or it could be that you'd prefer to call up, or there's also an option for people to book a slot for a call back when a referral can be taken over the phone as well, and the information covered via a phone call. So there's different options there. As mentioned, any professionals can refer in, and then we also accept self-referrals from parents, carers, or young people and young adults wanting to access the service themselves. Next slide, please. Just to give you a brief sort of rundown of what happens when we receive the referral. All referrals are screened by managers just to make sure the information on the referral form it's looking like somebody would be eligible and would be the right service for them at this time. Sometimes there's information on there that we might check in with that young person or check in with a referrer just to clarify something. But once that's screened by the manager, we then complete a triage call, and we aim to complete one within 2 working days of that referral being received, where we like to speak with the young person directly, because sometimes the person making the referral may have only had a chance to speak with a parent, for example, and sometimes parents aren't aware of absolutely everything. So we like to speak with the young people directly just to ensure we're absolutely capturing their voice and finding out what it is that they want and what's going on for them at the time. Following that triage call, they would then go on to the first assessment, and then, if appropriate, session 1, followed by the whole programme. And risk is managed at every stage here. And if at any point it's deemed that a young person is too unsuitable due to high need, then we would complete safety plans, share information appropriately, refer on to relevant services, etc. Next slide, please. So this is, again, touching upon risk management to talk through the process that we went through just now. Our waiting lists at the moment are around 32 days between triage calls and then initial assessments. So we complete duty calls in between just to check in with young people. They're set to check in at every 28 days. So if somebody's having to wait longer than 28 days between sessions, then we'd be completing calls just to check that nothing has changed for them and risk hasn't escalated in the meantime. We have clinical supervisors, monthly case management reviews, audits, and we also ask a set of safety questions at every single group session, again, just to make sure that risk hasn't escalated in between, and we look at whether any additional support needs to be put in. Next slide, please. So we complete safety plans with absolutely everybody. We believe everyone should have a safety plan, and it should be completed before the point of crisis. So that's something that we do with everyone on the programme. And we also encourage people to have first aid kits. So we talk through what would be useful in those, and self-soothe boxes as well. So we go through those and look at, I haven't got time to go into too much detail now, but we've got videos on our social media pages if anybody's interested in looking at what we recommend having self-soothe boxes.
Next slide, please.
So here's our contact information. These slides will be sent out afterwards. Please do feel free to get in touch or visit our website. I welcome hearing from people. And then the final slide is just detailing around our drugs and alcohol service for young people, which you may have heard of. So in Kent, we also have a specialist service supporting young people around their substance use. So if anybody has any further questions around that, then again, you can visit the website or call the telephone number details.